Hi guys, thanks for joining. This is Essence of Medicine. Today we're going to be talking about what is spondylolisthesis.
Spondylosis and spondylolisthesis.
Spondylosis and spondylolisthesis. First of all, I think we should identify what is the difference between the two of them.
Oh, well, introductions aside, yeah, it's a bit of a word salad for them. Dominic Moore.
And I'm Dr. Abbasi for Essence. Dominic, you should start.
What is the difference between the two?
Gotcha. Amanda, I think you need to come a little closer to the microphone. Your voice is very muted.
Oh, there we go. Gotcha. So aside from them being very, very similar words and kind of a little word salad for them, spondylolisthesis, if you break it down, the listhesis is the disconnect. So that's essentially when a level of your spine, my fist, is distanced like that. And then spondylosis, a lot of times, is when you get that sort of compression back there where, okay, usually you have that normal spine, and instead, all right, we're getting all this pressure and this pathology on the side, bone on bone sometimes if you get pretty far. But yeah, so one of them is the motion, and the other one is a lot of the times just the degeneration there.
Okay.
So that's the surface level of it. There's, of course, the fun nuances, but that's where we go, where we start.
Let's identify first what our spine is made of. To understand what the pathology is, we have to understand what the anatomy is. Amanda, I think everybody knows what spine is, right? What do you understand as somebody who didn't go to med school or PA school? What do you understand what spine is and what does spine do for us?
Obviously, the spine is the bones, and then there's some like nerves and things attached and running through, some muscles and some veins.
Yeah. Well, practically, literally, spine is the backbone of the human being, right? It is what connects everything together. And there's actually very interesting embryologic kind of phenomenon that all vertebrae have in common. Does the word notochord mean anything to you, Dominic?
No, it actually doesn't.
Me neither.
Now, see, I am in my element now.
Oh, good.
The story goes about 700 million years ago, when we started having multi-cell organisms. At first, they were just bunch of cells together, like sponges and so on. And then they start moving around, and then we had invertebrates. At certain point, evolution decided if it organizes these cells in certain way, it can gives it better motion. Motion equal good. Motion equal I come and eat you, but when you come to eat me, I can run away or swim away faster. So now, but how to do that? How to make a bunch of cells, organize them in a way that they can move faster. Okay. The nature tried many things, but then it decided it create, when we are a bunch of cells, it practically they take part of that cells in and it make a tube, literally like a tube, like a worm, but the worm is hollow inside. It's truly like a tube. Then this tube, imagine like a cylinder. On back of the cylinder, some of the cell, they go inside, they make a tube inside of a tube. So tube inside of the tube, first a tube, first bunch of cells, then a tube, and on the back of the tube, cells they replicate, and then, but they don't replicate out, they replicate in, and then goes even one next layer, and then we have the 3 layers. So that happens almost twice. Then we have the 3 embryological layers that makes a human being. What did they tell you what those layers are in the PA school, Dominic?
Honestly, I'm too far back for that.
That was old Dominic.
Well, they not to get too far, but they did a lot of not explaining child or fetal medicine for us down in Florida. They were kind of like, we're not going to touch on this one. If it becomes relevant to you because you go into anything else later, you'll learn it then.
You see, that's the beauty of it. If you understand that, you understand the pathology, why a disease is the way it is so much better. Now, the words are ectoderm, mesoderm, and endoderm.
Okay, that makes sense.
Meso, endoderm. And our brain is actually made of the same embryological material that our skin is made, ectoderm. Oh yes.
Okay.
Our organs are mostly made of mesoderm. Most of our bone and the muscles are made of endoderm. But there's lots of collaboration there and so on. But do you remember I said there's a tube, and the tube grows internally, make a second tube.
Mm-hmm.
That tube, outside of the tube, is ectoderm, which make our skin. And then when it turns inside and separate, that makes a neural tube, truly a neural tube that becomes our brain and spinal cord.
Oh.
But the story is not done yet. The story goes farther. Now, how do you segment that? There is this mystical mystery in our body, and that there are these rudimentary cells. They are minimum. Then a few cells, or a few hundred or thousand cells, which is nothing. They organize that when they happen. If one is here, it prevents another one exist next to it. It has to be in a certain distance. And so practically a bunch of cells along the neural tube develop. This bunch of cells along the neural tube, what they do, that practically, if there is one here, it prevents anything develop next to it. It has to be a certain distance. Certain distance.
Staggered out.
Staggered out, yes. And that's the whole magic. That little bit of a tissue there actually induces development in the cells around this. Some of them, in fish, actually, we found out all of that in fish. Some of them, they make gills, and other organs, and so on. And some of them induces our brain. And some of them induces our individual vertebrae and the nerve associated with that. Have you ever wondered why in our body, I'm sure you have learned that, the nerve, an artery, and a vein, they always travel together?
Yeah.
Have you noticed that?
Mm-hmm. Little pack.
We say there first in the groin first comes the Van Dyke, the nerve, vein, artery, nerve.
Yeah, you get deeper, you get worse.
Yeah, and then all our body is made of this, and then in some of them, even this few of these segments, they come together, they grow together, they make our extremities. If you take, literally, they have done it with frogs and some other animals. If you take some of those that makes our hands and legs and implant it somewhere else, another additional legs or arm grows there. This is so easy. It was 100 years ago. Some crazy people like me had nothing to do, went to the lab. They took some of this after they were developed, these segments, after they were developed. They just mixed it around. And all of a sudden, a leg was growing from the head, and an arm was growing on the buttock.
So is that why sometimes, like, for instance, today I saw a cat that had 4 ears? Would that be because things are just kind of mixed up?
Well, that is, for example, could be that part that makes the ear that segment that makes the ear, it duplicated erroneously,
Mm.
and all of a sudden they're, even though they're not supposed to be too close to each other, they're still duplicate, and they're too close to each other and make multiple of that. Or a segment, you miss a segment, then you're missing organs. Like
Yeah.
all of a sudden, people don't have arms or legs or
Or a lot of
brain
people
or
are
brain.
born. A lot of people are born without all of their teeth, like all of their adult teeth. For instance, my sister, she doesn't have all of her adult teeth because some of them never grew.
Now,
Would that be the same thing?
well, lots of people miss, this is very, very early in the development. If
Mhm.
that part is missing, it's not a little thing. Like you miss an arm or you have forearm. If
Mhm.
this is not like, small little, it's bigger.
Yeah.
The effect of that is bigger because it's earlier in the development. Now, what is that series of cells? Now we have ectoderm that makes the skin, make the neural tube, and inside of you, this neural tube is underneath it, there are these cells, little cells. Do you know what those cells called that they go along the neural tube?
Are those ones the stem cells or no?
No, everything is stem cell. No, they're
Okay.
called the notochord. Have you heard the?
Oh, that's where we get to it.
Yeah. Now, each of those cells in notochord, they induce a vertebrae.
Mhm.
You remember? One notochord cell, space. One notochord cell, space. One notochord cell, space. Now, each of them induce a vein, artery, nerve, and hence we have all this, like C1, C2, C3, up to C6. We have thoracic, 12 thoracic. We have 5 lumbar. We have few sacral. Each of them is induced by a notochord. Now, between the notochord, that's the beauty of it now. Between the notochord, vertebral body come to existence. Repeat that. Dom.
Between the notochord, the vertebral bodies come.
So what notochord end up to be?
Have to end up as the discs. no?
Yes. Yes.
Which if I had to guess, I was not going to go there with the discs. I'll be honest. I thought they were going to end up being the vertebrae. So
No,
I'm
but
kind
you see that there? That's the beauty of it. We know from history, you see, nature, physics, universe repeat things.
Hmm.
Do you know who are the worst peacetime leaders? The best wartime leader are worst peacetime leaders. Like Mao, like Tito, like many others. The worst peacetime leaders are those people who were the best wartime leaders. When you're growing, it's war.
Mhm,
Lots of
mhm.
action. Nature knows these cells, they're trouble. They just want to grow things. They want to do things. They cannot sit around. So it confines them in a place that is least active. They vanish. And there are two structures in our body that have the least amount of cells. What are they?
Mm.
Least amount of cell in our body. You watch me with one of them.
Your eyes.
Vitreous body in your eyes.
Oh, okay.
Have very little cells, living cells. What is the other one? You know it. We just talked about it.
Your
This.
no.
This.
Oh, okay.
That's not what I would have thought.
Huh.
This.
It's got to be something, right?
Okay. This has barely any living cells in it. Barely any. Now that we know that, all of a sudden it makes sense why putting stem cell in a disc to make it grow wouldn't work. You see, if you know history, you know the future. If you know embryology, you know how human body reacts. So it's like a crime story. These cells are so active. They build everything. They make you. As a matter of fact, you have 12 cranial nerve because there are 12 segments in your head that makes that, there are more than 12, because some of them, they make the frontal brain, and then the brain, cerebellum, brain stem. In fish, the same thing that makes like part of your larynx makes the gills.
Oh,
One. It's not surprisingly, the segment that make your eye is one of those segments, cranial nerve 2. That is a segment. It makes everything. It makes the retinal artery, it makes the optic nerve, everything. So now it building this segment in your spine, and itself become the very, very inactive. As a matter of fact, I have a theory, I don't have a proof for it, that our body knows, okay, this is the wartime general. If it goes to the peacetime, it's going to grow 5 arms out of your back. We have to confine it. It is that like prison for Magneto from X. It builds the disc around it to confine it, make it inactive. This is my theory. I have no proof for it. But so now you have these segments, bone, disc. They come together. Notochord becomes disc, but it induces the bone, which is the vertebral body, with all the nerve, artery, vein associated with that. Now, our long bones, like, are from some of this. So what nerves go to our arm, Dominic?
Those are the cranial ones, the cervical ones.
Which one?
So we've got, namely, over here,
4,
four
5, 6. Here, you remember 6?
Yeah, 6.
7.
And then 7. Yeah.
7 actually goes this, and half.
And a little bit of half.
Yeah. And 8. C8. Okay? And then others make our legs and so on. But many of them as just do our organs inside and so on, or induce the artery nerve to those organs, because the organs in themselves are made by mesoderm, not by.
Okay.
So, but either way, now you have these segments, bone and disc. Okay? And nature says, wonderful. I can make it as long as I can, as I want. Then you have snakes, you have alligator, and so on and so forth.
Giraffe out here.
You have, well, surprisingly, giraffes with all their long neck, they have as many bone in the neck as we humans.
Wow.
Really?
I'm really surprised by that.
Absolutely.
They must just be really big bones.
What the heck is? Yeah, it's got to be a vertebrae like the long,
like
of my
long vertebrae.
Yes. Isn't that amazing?
Yeah.
Let me tell you,
Okay.
nature did really messed it up. Okay. You remember we said this story started like 700 million years ago. It's a crime story. Okay. Now, when it was doing that, it was sending some nerves to our larynx, because we have to eat things, right? And we need to control our mouth and teeth and so on. But as well, the fish, they have these gills that is important for the breathing. Okay? Now, eventually, we came out of water, and then we were breathing air. So there's added complexity. That itself is another podcast. I'm not going to go to depth, but it's a beautiful story. But long story short, one of these segments and one of these arteries, they weren't in the initial location anymore. Imagine this was one of the artery and this was the nerve. This artery that goes to the gills and so on, all of a sudden moves down and down and down. But this nerve, it goes still to the organ that's still here. So originally like that, it still has to end up here. But this artery goes down and down and down. And then there is a nerve that goes all the way down our chest and comes back to our vocal cord so we can talk.
Oh, the recurrent laryngeal?
Recurrent laryngeal nerve. It has to go all the way down because in fish, that organ, the gills, are above it.
Mm-hmm.
So no problem. But then that moves down, but the nerve still has to stay there. So it gets longer and longer and longer. So in giraffe, that nerve goes all the way to the chest and goes back up to giraffe. That's why they can never talk. They can never talk because by the time their thoughts goes from their brain all the way to their chest and comes back up, they forgot what they wanted to say.
I always wondered why it was kind of this looping cul-de-sac, this nerve right here. And now just imagining a poor giraffe just having this giant cord going down and coming back up because their body just said, hey man, it's got to go below that artery. I'm sorry. It just does.
That's a good dad joke to use later.
So now we have long story. We moved now almost 750 million years. And now we have primates. These primates, and the spine is good. Spine is good. It let you move. It let you move around beautifully. And that's one of the things you should look at. Just by looking, as a matter of fact, but just by looking how an animal swims, you can't say if it's a mammal or a fish. Because fish move this way, like this way.
Side by side, side to side.
Mammal go up and down. Look how a dolphin or a shark swim. Dolphin goes this way, shark goes this way. Yeah. And but either way, nature says, man, I'm so good. Look at how fast they can go. Have you seen how fast whales and dolphin and shark can swim?
Mm-mm.
All function of the spine. Without the spine, none of that would be possible. Look at invertebrates, how fast they can go versus the vertebrate.
So do they ever get spondylolisthesis or?
Oh, the story goes farther. We haven't even started. Now,
okay.
Most of fish, their spine is really doesn't have a load, doesn't carry any load.
Yeah, they're very buoyant in there too. So,
and most of vertebrate, because the way they are on four feet, literally. Their spine have only one arc. But eventually, nature says, yeah, spine is good, but wouldn't it be great if I can stand upright so I can look further? And that's where all the problem starts. Human starts standing up, which is a huge advantage, by the way. You can look further, and walking on 2 versus 4 is the most energy efficient thing. Mile by mile, kilogram by kilogram, pound by pound, human has 2 advantage to any other animal. We use more brain matter and energy for our brain than any other animal, and we spend least amount of the energy walking than any other animal. But the problem is the spine is made to not as a load bearing, but as a literally locomotion apparatus. And with all its benefits that we have, now all of a sudden you're standing up, all of a sudden your spine has to make this curvature, because you see, with a regular curvature, imagine, have you seen the Gru from Despicable Me? How his back has one curve. You don't walk like that. You walk straight. And 3 curvature in our spine enable us to walk straight. Do you want to tell them what they are?
Yeah. So here, Amanda, if you wouldn't mind, this part of your neck, lordosis, curves a little bit like this. I don't know if you can
Bend forward.
Forward.
Yeah.
Then this middle part here, the thoracic, where kind of our ribs are and whatnot, bends the opposite direction outward. So, an exaggeration is that, but that way. And then down here in the lower back, we bend forward again in our lumbar, little lordosis. That's an exaggeration, but again, like that. So we have swoop, swoop, swoop.
Yes.
Got it.
And babies don't have it, right?
Nope, just a little.
Yeah, babies. That fetal position, that's what called when you bend forward like a C.
Just a little circle. Well, half a circle.
Yeah.
Well, and when did we start doing that bipedality? When did we start humanity? And what other animal are bipedal?
Well, primates. Like some of them are.
Can walk, but they hate it. They watch a gorilla or a chimp walk, and then you see they do knuckle walk, meaning they still walk on four, but they absolutely hate it. They're just so bad at it.
Birds.
That doesn't count because
they're not mammals.
Yeah, I'm talking about mammals. Now, kangaroos, you can say they're bipedal, but they have developed a huge tail to compensate for their body.
Are marsupials the mammals?
Marsupials are mammals, yeah.
They just have mammals with a pouch, basically.
Well, this is an early, branch of the mammals where they don't lay egg, but their baby, when it's born, it is very, very immature. It has to crawl, literally get out of their vagina, crawl to the pouch where there are milk organs, and then they drink milk in the pouch warm until they achieve certain size, and sometimes they don't want to come out. Then you see a huge kangaroo, the mother, and the mother's like just looking, oh really? This is like your mother throwing you out of your house.
You're 18, leave the pouch. Like, come on.
But actually, that is amazing. You have to see it. It's beautiful. When they come out, that little bit of a cell, almost transparent. They have to crawl from the vagina all the way up to the pouch because they're not connected.
Oh, wow.
Yeah. So you see.
So what other mammals walk on 2 feet?
Most of primates, they can, but they hate it. Human is the only mammal that is designed to walk on 2.
Okay.
It's an exclusive club.
Yeah, we human killed all the others because all the others who would walk on 2, they were in direct competition to us.
That makes sense.
Very human.
Very human, right? They must have
been doing it since the beginning.
Some human must have been true American.
Oh, I bet they were.
Red-blooded humans.
Yeah.
The American.
USA. USA.
Said the first human in the African savannah.
Oh, you walk on 2? We are going to bomb you. You are out. You are out. Neanderthals, out.
Yeah, no competition. Humans cannot stand competition.
So,
man.
But when do you think that happened, Amanda? When do you think we started walking on 2?
I think obviously pretty early on. I would say before the Ice Age.
About 1 million years, but in the last 100,000 years, we got better and better and better and better. In the last 200,000 years, that we are truly bipedal, and we have refined the art of it. But about 1 million years ago, we started.
So maybe 1,100,000 years ago, we were more crawling, using our hands for.
No, about 1.2 million years ago, we started, going from a knuckle walk to real walk.
Yeah, that was my question. Were we using walking sticks or what? So we were using our knuckles?
No sticks.
No tools?
Chimps. Knuckle walk.
Okay.
Like gorilla. We could walk on 2 only if we wanted to impose on
Yeah. I'm big, Mr. Bear. Stay away. Like,
Yeah.
But we started 1.2 million years ago, and just a few hundred thousand years ago, we mastered it. Few 100,000 is not a long time.
No, I mean, gosh, we spent 900,000 doing whatever, you know.
So what I'm getting at, imagine you get a dishwasher and you use it to make your laundry.
Pretty
That is
inefficient.
what spine is. Our spine is made for us to go on four, and now in the last few 100,000 years, we are using it to go bipedal.
Okay. Well.
Okay, well, now we are at the let's talk about spondylolisthesis.
Let's actually just keep talking about the evolution of the spine, because we're 30 minutes in and I had a specific purpose for this topic. So let's just keep talking about the evolution.
No, but we are there. No, that was all to understand what spondylosis is. Spondylosis, Amanda, what is arthrosis?
I don't, maybe like something wrong with the joints.
Yeah, that's exactly.
Yeah, yo, you know what? That's solid. That's solid. You've been around long enough, huh? We might need to get a new generic person. She's getting a little too smart.
Yeah. Every time bone, cartilage, joint goes bad, we call it arthrosis. Okay? Now, the other joints are for locomotion, meaning, and spine is to keep those locomotion apparatus connected and give it a posture. Now, spondylosis is the arthrosis of the spine, meaning that even though it's not real joint, it is just for the posture, and the motion in the facets are minimal. Now, our spine is made of the vertebral body that carries about 80% of our weight, the bone, disc, bone, and the disc between is like a tire of a car that cushion to bone. It let it literally move in different direction. Like imagine you sit on a air cushion, you're bouncing around to a certain degree, and the facet in the joint are limiting that motion, actually. The facets are joined in two facet joint in the back of the spine. They are at certain angle that allow this bouncing and motion to be limited in certain direction.
Like a chair with a good cushion, you know. I can't go all the way, but I can go far enough.
It limits that. Now, and it gets even worse with what we talked about. It has to carry our weight, which is not designed to do. You remember we went all over, and too long actually to just come here. And now, and even worse, it has multiple curvature that put more stress in one area versus another. Okay, now, as you know, the vertebral body are getting bigger and bigger top to bottom, right? Because they have to carry more weight. They weren't designed to do that. Like if you take a deer or pig, actually I just cooked a deer, Persian food. All the vertebrae more or less are the same size. They are not different size.
Oh.
Yeah. But in human, it carries more weight, top to bottom get bigger.
I guess that makes sense, yeah.
And certain vertebrae have more motion than the others, like in cervical spine. No, cervical, thoracic, lumbar spine. Which one has more motion? Amanda, what moves more? Neck, chest, or lower back?
Well, Dominic actually just gave us a great example that your neck moves really well.
Your neck moves mostly because it's important to see the lion.
Keep your head on a swivel.
Exactly. Now, chest moves the least, and the lumbar spine is practically the second. Now, in the cervical spine, certain vertebrae move more than the others. Like, Dominic, most of the right and left motion in the neck is between C1, C2, right?
Yeah, we just kind of pivot.
But actually, the most of the motion, other motion in the cervical spine is what level? C5, 6, 7.
Yeah, nice and low.
So how often how often do we do ACDF C5, 6, 7 compared to other levels?
Oh my gosh, I think I've seen one that has been higher than 3. You know,
So most of that 80% is in the lower cervical spine. In the lumbar spine, again, there is more load and more motion in what levels?
down at the bottom.
4, 5, S1, L4, 5, L5, S1. And that's as well the reason more motion, more weight, more pathology, more degenerative aging process, more arthrosis, which in the spine we call that what? Spondylosis. Meaning
there you go.
the bone and the disc become less mobile, less elastic. They grow at they grow on the sides. We call that osteophytes. They lock into each other. They become less. What's the difference between a young skin like Amanda's and an old skin like your grandma, Amanda? What's the difference between your skin and your grandma's skin?
Tightness, stretch,
and yes, you're on the right path.
Velocity. Like my grandma's skin is much more see-through than mine.
Well, has less collagen, less hydrated. It's less. I would say it is more brittle. They get wounded faster than a young person, right?
Oh, much faster.
Yeah, it's like a sponge. You leave it to dry out too long. Eventually, you come back to it, and you just stiff.
That doesn't just happen to our skin. That happens to all our organs. Okay, like our vessels, or cartilage, or ligament, or bone, or disc, or vertebrae. And your mechanical sign of that you see that the disc is gone, bone is on bone. Or those ligaments now, spondylosis is a general term. Like my doctor said, many of my patients said, my doctor said I have arthrosis. Arthrosis is a general term. And so is the spondylosis for spine. So arthrosis is every time bone, ligament, cartilage goes bad, it's called arthrosis. Arthrosis of the spine is spondylosis, but still that's a general term. And now a certain kind of spondylosis is when those ligaments that hold two bones together become loose, and instead of bone moving this way, it shifts this way. What is this called?
Spondylosis?
One more? Add a little more?
No, it is spondylosis, but the special kind of spondylosis. Spondylolisthesis.
Listhesis.
Yep.
Spondylolisthesis.
Can you break down that word? Like, what are the meanings behind it?
Okay. Spondil or spond?
No, I know. Spon is
bone or vertebral body.
Dill is
Spondylosis, meaning the disease of the spondyle or the bone, the vertebrae. Spondylolisthesis, meaning what does listhesis mean?
Slip.
Oh, okay.
Slippage.
And because it shouldn't. Our bone should not move in the bone, in the vertebra should not move slide like this. It should move this way, but not this way.
Yep. Okay. Like a drawer.
Yeah. Got it.
Yeah. Okay. Now, obviously, older we get, less elastic the material will become, more the bone grows in the wrong places, less motion will be in the spine. We have talked about that before. If you have a question about when this process starts, when do you think the spondylosis process starts in our body, Amanda?
Like 30s.
You wish.
When? Well, I know that our spine is at its peak when you're like 12 to 16. So I guess maybe I would actually even go as far as to say mid-20s is when I think it would begin.
I would say early 20s.
Early 20s?
Welcome to the bunch, Amanda. Welcome.
Please don't put me in your group. I do yoga and stuff. I'm not going to rush that.
Dr. Abbasi, help. My thoracic has been bothering me all week. It's over. It's over.
Yeah, I try and be really gentle with myself. So I don't want to expedite any type of any type of anything.
Join us.
No, I'm not joining you.
It's part of being human.
Amanda, you're going to live forever.
That's also what I don't want. I don't want to live forever.
Elaine, Amanda.
I want to live good, fast.
But either way, that process, it's an ongoing process.
Yeah.
After puberty, is an ongoing process. And that include the content of the spine, bone, disc, and the joint in the back we call facet joint. That's why many of my patients, when they come and tell me, how much mobility will I lose after the surgery when they need a fusion? What's the answer, Dominic?
Honestly, you'll probably gain some mobility.
Yes.
It'll be the right kind of mobility.
But that's a fusion. You fuse them, you get the motion away. Why would they gain mobility?
Because they're no longer limited by all these other pains. Like,
yes.
Let's say, we've got that compression right there. I can really only move so far. And if that, I can't really at all. And once that's done, I can accurately use everything else.
Most of the time, by the time they get to us, that motion is already lost. When it's bone on bone, there's nothing there. There's really no motion left there. What you do, you take the pain away so they can use the other segments.
Yep.
So
yeah, I think that's a really common misconception with spine surgery, like fusions, because I remember my grandpa before he passed had really bad back pain. So he came here and you're like, okay, yeah, you probably need a fusion. And then my uncle, because he works for Medtronic in the heart department, he's like, don't get a fusion. You'll never be able to move your back again. Like, dude, he already can't. His back hurts.
We just had a patient on Tuesday who had a 3-level fusion before, and I was talking to her, and she was showing me, well, look at me, I can touch my toes. And I was like, man, I don't know how you're doing that at 7. All right. I was more scared that she was just going to fall over. There she goes all the way down.
So, and that is why spine is such a complex joint. It's not like any other joint that you do a surgery and it is the most complex part of our body. When I'm a neurosurgeon, I'm trained to do brain surgery and so on, and people don't get it. Doing brain surgery is easy compared to spine surgery. You just open the skull. Their standard way of opening the skull, you open the skull, you open the dura, and then you get a sucker and a bipolar. You're just careful and beep, 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 beep. Then you take the tumor out. Compared to spine, brain surgery is easy. And the amount of experience, you do 20 brain surgery, you're good at it. You do 500 spine surgery, you're still learning. So that is it's not a rocket science. It's not a rocket science or brain surgery. It's a rocket science and spine surgery. Okay? And that is why when people come and watch what we do, they're so amazed that we are so efficient doing this complex kind of surgery on high BMI people so efficiently. Because it is a big deal to do. See, you remember notochord. What was notochord?
Turn into those.
It uses lots of vital structure to grow. So that is the center where you start growing everything else. So everything comes there together. It's like a terminal. All the nerves are there, major vessels are there, your spinal cord is there.
Central station.
That's the central station. Exactly. There you are. So, did we answer that, Amanda? Spondylosis and spondylolisthesis?
Yeah, I think so.
Okay.
Honestly, Amanda, you got to give yourself props because you have been doing some heavy lifting today.
Oh yeah.
Well,
thank you guys for watching. This was the Essence of Medicine. Today we talked about what is spondylosis. Right?
Yeah.
I'm Amanda Armagoss.
Dominic Moore.
And I'm Dr. Abbasi for Essence, and we went 780 million years back.
I hope you enjoyed the time machine. Welcome back home.
Okay, bye-bye.
Bye.